James Reynolds, August 10, 1953.
Okay, can I go ahead and see your wristband? Alright, checking the wristband, everything matches. Okay, Mr. Reynolds, well, I understand you've been feeling dizzy and lightheaded. Can you tell me more about that?
I feel dizziness whenever I try to stand up. Sometimes I feel like I just might pass out soon.
I see, that sounds really concerning. Have you ever actually fallen?
No, but I've come close a few times. Sometimes I just have to hold on to some furniture.
I see. Have you noticed the dizziness happen at a certain time, like after meals or when getting out of bed?
It's mainly like when I get up in the morning. When I sit down, it's all good.
I see. Well, I'm going to go ahead and take a set of vitals for you. I'm going to go ahead and have you lay down.
Okay, sir.
And could I have you take off your jacket so I can take your blood pressure?
Of course, brother.
12 seconds later.
Alright, Mr. Reynolds, I'm going to go ahead and have you stand up now. We're going to take your vitals standing up, okay?
Yes, sir.
Do you need any help?
Yes, please.
Okay. Ooh. You got it?
Yes.
Okay. Alright, I'm going to go ahead and take your vitals now. Alright, Mr. Reynolds, well, it looks like your blood pressure was dropping when you stood up, so I'm going to have to go ahead and talk to Dr. Carter and talk to him about what's going on. We may need to run some diagnostic tests, okay? Alright, go ahead and just sit tight. Mr. Reynolds, I wanted to ask about your past medical history. Can you talk to me about any conditions you may be having?
I do have a history of type 2 diabetes.
I see. And do you have any allergies at all?
No allergies, sir.
And are you taking any medications?
I'm taking lisinopril and amlodipine.
Okay, lisinopril and amlodipine. I'm going to go ahead and let your doctor know, okay?
Yes, sir.
Okay. Right. Good morning, Dr. Carter. I wanted to give you an update in regards to our new admit, James Reynolds.
Good morning, nurse. Go ahead, give me the rundown.
All right, so I took in his vitals when he was laying down. His blood pressure was 118/72. His heart rate was 78. His respiration rate was 16. His SpO2 was 98% on room air, and his temperature was 98.2 degrees Fahrenheit. I also took his vital signs standing up, and his blood pressure dropped to 85/60. His heart rate rose to 92 beats per minute. His respirations increased to 18 breaths per minute, and his SpO2 stayed at 98% on room air.
So I see. So that seems like a problem there with that blood pressure. So I'm just gonna have to go talk to James and James, was it right?
Yes.
So I'm gonna have to go talk to him. Probably run more diagnostics. This looks like a classic case of orthostatic hypotension. So I'm gonna get that locked in. I'm gonna go talk to him. Okay. All right.
12 seconds later.
Hi there. Good morning, Mr. Reynolds.
Good morning, sir.
How you doing today?
You're doing good.
I'm good. I'm doing all right. Better days.
That's good to hear, sir.
That's good to hear. So, just based on your symptoms and your BP readings, it's looking like you have orthostatic hypotension. Have you heard of that?
No, sir. What exactly causes that?
That condition?
Yes.
So, well, basically your blood pressure drops too much when you stand, causing that sort of dizziness feeling that you've been having, right? Dizziness? So yeah, I heard from your nurse that when standing, when you tried to get your vitals, you did have some trouble getting up, right?
Yes, sir.
So yeah, so basically, normally your body vessels, when you stand up, you're trying to keep that blood flowing to your brain, all right? But in your case, that response isn't strong enough, okay? It's kind of a bit wonky, okay? And that's likely due to a combination of factors. I do see that you have diabetes, okay? So that's a big major factor, okay? And your age, okay? You look like a young, strong 50, okay? But you're 72, okay, sir? So and possibly your medications, okay? That's also could be a major factor, okay? So it's just like a whole team going against you right now, okay? So So yeah, so we're just gonna order some diagnostics just to get a rundown, okay?
Oh.
Just to confirm this diagnosis, okay?
And what diagnostics exactly?
We're gonna hit you with a electrocardiogram. That's an ECG.
Okay.
We're just gonna check for any heart rhythm issues, all right? So we're just gonna look at your heart, all right?
Yes.
And then we might have to hit another diagnostic test. We're gonna hit you with a basic metabolic panel. So that's just gonna evaluate your kidney function and your electrolytes.
Yes, sir.
All right. And would you be okay with all that?
Yeah, sure. Yeah, as long as we can stop this dizziness.
All right. Okay. So we're just gonna run that for you, okay? So thank you, Mr. Reynolds.
Thank you. Thank you, sir.
A little longer than a few minutes later.
Alrighty, ready guys, welcome. Just to give a brief rundown here, we have James Reynolds, 72. He has orthostatic hypotension, most likely caused by an autonomic dysfunction as seen in our diagnostic test. And so just based on this, I've started him on Midodrine, 5 milligrams, 3 times a day. Nurse Jacob, any safety concerns?
Yes, he's at a high fall risk. He nearly fell twice this week. I recommend a PT consult for balance training and a home safety assessment.
Good call. Mark, can you handle that?
Absolutely. I'll work on fall prevention strategies, safe transitions from sitting to standing, and recommend assistive devices if needed.
Oh yeah, you're right. Thanks, Mark. And so, yes, Dr. Carter, Midodrine is a good choice, but we need to monitor for supine hypertension. I'll make sure to print out a pamphlet or a paper to give to Mr. Reynolds, to you, Nurse Jacob, to involve a lot of all the instructions, such as avoid taking it too close to bedtime and how to take it, when to take it. And also, I'll review his other meds like lisinopril and amlodipine, because that could be contributing to his low blood pressure.
I'll also educate him on fluid intake and compression stockings to help with circulation.
Perfect. Let's check in next week and let's adjust as needed. Thank you guys.
All right, Mr. Reynolds, well, we have a plan in place for you. We're going to be starting you on Midodrine, 5 milligrams 3 times a day, but you need to take it at least 4 hours before bedtime to prevent high blood pressure while lying down.
So that's early morning, midday, and evening.
Exactly. So yeah, we're gonna need you to watch for side effects like goosebumps or tingling on your scalp. Okay. Urinary retention, essentially you holding onto urine. Okay, not being able to pee it out. Okay.
Yes, sir.
And of course, high blood pressure while lying down. Okay. And if you feel a headache or pressure in your chest, let us know right away. Okay. And your pharmacist will give you a whole handout with all these instructions. Okay.
Got it. That's helpful.
And physical therapy will be here shortly, working with you on safe ways to stand up, some balance exercises, and possible home modifications to prevent falls, okay?
That's great.
And then one last thing, make sure you're drinking plenty of fluids, make sure you avoid any sudden movements, and consider wearing compression stockings during the day to help with your circulation.
Alrighty. We'll see you in 1 week, okay, boss?
Thank you,
Okay,
sir.
and of course, let us know if any dizziness, chest pain, okay?
Thank you, guys. I appreciate the team effort. It's so helpful.
Here to help.
Thank you.